Hello beloved, welcome to video 2 of my channel. In this segment, we shall be discussing the causes of GAD. GAD could have a physical or a psychological cause. The physical causes could be the following: blood sugar imbalance, nutritional deficiency, that is deficiency of protein, B6, B13, magnesium, zinc and iron, IBS or irritable bowel syndrome. Sometimes IBS could be a byproduct of GAD. With IBS, it's always a case of which came first, the egg or the chicken. It could be a cause as well as a symptom of GAD. Other physical causes may include low-grade brain inflammation, hormones, thyroid issues, heart disease, gastroesophageal reflux disease, and anemia. Some of the above are self-explanatory, but let me explain the others. So let us discuss blood sugar imbalance. Eating a lot of bread, sweets, etc. may lead to a sudden rise in insulin, which gets you feeling great, followed by a drastic fall which leaves you feeling crappy. This dramatic rise in blood sugar levels leads to hypoglycemia, which can mimic the symptoms of anxiety. Whatever may be the cause of anxiety, please try and cut down to foods I mentioned so that you don't experience these blood sugar swings. Don't do it drastically, as withdrawal symptoms from eliminating sugar may become worse than the symptoms of your anxiety. Do it in small, doable stages. Health. Magnesium is a relaxation mineral that is essential for numerous biochemical imbalances in the body. It's called the chill pill and enables one to feel less sensitized. It helps promote better sleep and a healthy heart. Problems with hormonal regulation may occur in anxiety sufferers if you're a woman. Estrogen and progesterone that control fertility also control brain and nervous system functioning. Fluctuation in estrogen levels leads to PMS, PMDD, and a host of other conditions in women. Lowering of estrogen could lead to some of the more depressive anxiety symptoms. High levels of estrogen combined with low levels of progesterone may cause anxiety symptoms. If you have high levels of cortisol, that is a stress hormone, then the level of progesterone in your body may suffer. Check with your doctor to see if hormones could be one of the causes of your anxiety. Regarding brain inflammation, since we don't have pain receptors in our brain, we are not able to detect inflammation like we do in our knee or any other joint. We aren't able to notice if our knees are red, swollen or anything like that. So brain inflammation may sometimes manifest as brain fog, difficulty concentrating, negative thoughts and so on. Doctors of naturopathy believe that most cases of anxiety are caused by brain inflammation. So please consult your GP in case you are suffering any of the above symptoms. They may have some sort of a treatment as well as a cure for your disorder. We already discussed the physical causes of anxiety, so let's check out the psychological causes. The psychological causes of anxiety are genetic. Someone in your family could have it. Some of us are naturally predisposed towards neuroticism than others. It could be a challenging childhood. Trauma and abuse in childhood leads the brain to grow up subconsciously viewing the world as a dangerous place. Even if the onset of your anxiety is later, a challenging childhood or a traumatic childhood could be a common cause. Your anxiety could also be due to prolonged exposure to illnesses. You could have been unwell for a long time, or a loved one could have a chronic illness which could trigger stress, uncertainty and insecurity in you. It could be brain chemistry. GAD has been linked to nerve cell pathways that connect brain regions involved in thinking and emotion. These nerve cell connections depend on chemicals called neurotransmitters that send information from one nerve cell to the other. If the pathways that connect particular brain regions to each other don't work well, mood and anxiety issues could occur. Excessive anxiety could also be due to misuse of substances like alcohol, caffeine, nicotine, etc. Now, these sort of substances exacerbate anxiety. So, first of all, please start by getting all your tests done to rule out the physical causes of GAD. Then, if there is no other cause left but psychological, please see a good licensed mental health professional. That's all for now, beloved. If you found this video helpful, please like, share and subscribe to my channel. Also recommend to other anxiety learners. And don't forget to hit the bell icon to receive notifications from this channel. Namaskar.